Hello and welcome to the Cancer Awareness Month radio series here on the Super Morning Show on Joy 99.7 FM. The Cancer Awareness Month is something we've instituted. So every month of October, we'll be bringing you the Cancer Awareness Month and bringing you expert conversations on cancer, what you need to know so that together we fight cancer, because it's emerged as one of humanity's most pressing health challenges. And we are recording millions of cancer cases every year. We are seeing millions of deaths from cancer every year. And it's a global challenge which has now also become very local. Because if you look at Africa, we are seeing approximately 800,000 new cancer cases every year, and 520,000 cancer deaths occurred in 2020. Now, what makes Africa's situation tragic is that despite substantially lower cancer incident rates compared to the high income regions, our mortality rate due to cancer is quite high. It's the same in Ghana. But what can we do together to fight cancer? And what do you really know about cancer to help you prevent cancer and fight cancer? That's what basically we'll be doing this month of October. And our first conversation is with Professor Kafui Akakpo. Professor Kafui Akakpo, he is an anatomic pathologist, and he's going to introduce us to the cancer disease. What really is cancer? Why is it evoking fear? How does it develop across different age groups? And he's basically going to set the foundation for understanding cancer in Ghana and its impact on patients and families. Prof, welcome to the Cancer Awareness Month.
Thank you, Kojo, for having me.
You are our first guest, so you are going to set the scene for us and enable us to have a great conversation this whole month. But before we start, just briefly, in about 30 seconds, tell me something about you.
So, as rightly introduced, my name is Kafui Akakpo, and I'm an associate professor at the University of Cape Coast Medical School. I'm also an anatomic pathologist, and that means that we make the diagnosis of cancer by looking at tissue or cells taken from any suspicious mass and delivered to us.
Now, we've heard of cancer. Previously, I used to look at the Ghana Health Service annual fatten figures, and it was your regular malaria, tuberculosis, this, that, all those regular diseases we learned in social studies that were killing Ghanaians and taking us to the hospital. But these days, it's changing, and cancer is becoming a thing in the country. But for most people who don't really know what cancer is, what is cancer, and why is it such a frightening disease?
So, cancer just means an abnormal growth of cells in any organ of the body with the potential to metastasize. And when I use the word metastasize, it's so important to remember this. What it means is that when the abnormal growth reaches a certain point, the cells that are growing abnormally can leave that site and go to other sites that are considered more fertile for growth and grow there. So in effect, your cells are growing abnormally in your breast, and at a certain point, the breast is no longer conducive for growth, and those cells can actually go in your blood and get into your brain and grow over there and also destroy your brain. So that is, in a nutshell, what cancer is.
So, does any abnormal growth in the body qualify to be cancer?
No. What separates other kinds of neoplasms, which are also abnormal growths, from malignant neoplasms, is the ability to metastasize. So the neoplasm is just the abnormal growth. And there are two kinds. You've got what they call benign neoplasms. These do not metastasize. They are slow growing. They remain at the site. They are usually well encapsulated, and so they can be removed easily. However, if you take cancer, this is what they call a malignant neoplasm. And these malignant neoplasms are separated from the benign neoplasms by their ability to metastasize. What it means then is that It grows to a certain point, and at that point, the cells have the capability to leave the point where they started and go to other organs. And usually they will choose these organs that are very well vascularized. So you look at the lungs, it's got a lot of blood vessels, and it's also got a lot of oxygen that is good for growth. The brain is another example, very well vascularized. And you also have the liver. And sometimes they even do bone, because bone marrow is also very rich in blood, and so you can grow there quite well. So these cancer cells have this ability to become immortalized, and that immortality, that ability to metastasize, allows them to keep growing and growing and growing. And of course, wherever they find themselves, there's limited space for growth, and the nourishment that is there is supposed to be for normal growth. But when you have a cancer cell, it's going to take over any part of your body where it finds itself, and eventually that organ is going to lose its function. And with that, of course, comes death. And you would find that this is the end result of malignant neoplasms, which are called cancers.
Wow. So based on your definition and explanation, I'm getting to understand why cancer creates such fear in patients and their families, that when somebody is diagnosed with any form of cancer, they just resign to feeling that it's definitely going to lead to death.
Good. So you would realize that anytime somebody is diagnosed with cancer, a number of things will be done. First, like you rightly pointed out, is it any growth that is considered cancer? And I said no. So what it means is that if you have a growth, you need to find out, is this growth a malignant neoplasm, which is cancer, or is it a benign neoplasm? But before you can do that, what you need to do is to get a biopsy, and you can get a tissue biopsy, or you can get some cells taken. And there are many ways of doing that. Some people will just use a needle. Some people will make a small cut into it. Some people, you even have to put them to bed before you can do that. And in some cases, you need imaging, CT scans, MRI, ultrasounds, to be able to get the tissue that is required for the diagnosis. Once that tissue is taken, it will be sent to the pathologist. The anatomic pathologist will look at it under the microscope and use a number of processes to decide that these cells that I am seeing are growing rather fast. And the evidence will be in what you see, because cells that are growing fast will tend to have a bigger nucleus. Their cytoplasm will be smaller because they produce a lot of genetic material to help them to grow. So it's not too difficult to see it and realize that, no, this cell is actually one of those cells that is growing very fast. If it becomes difficult, you employ other methods like immunohistochemistry, molecular methods, and these are scientific methods that help you to say that, you know what, this is one of those neoplasms that is ultimately going to result in metastasis. However, the good news is that it is not just a matter of making a diagnosis of cancer. When you have made a diagnosis of cancer, you would do a number of things. The basic ones is, what type of cancer is this? And the site is very good. You look at the site, you say, okay, you know what, this is coming from the breast. It is breast cancer. You would go on and look at other things like, what is the grade of this cancer? And when I say grade, it just means that, let's say you've got a cat in the house, something that is a feline. You want to tell yourself, or you want to find out, is this feline thing going to behave like a domestic cat, or is it going to behave like a tiger? How should I approach it? And that's grading of the cancer. When they grade it, they are able to say, oh, you know what, this is going to have a house cat demeanor. Behavior is going to be like a house cat. In that case, you don't need to be very aggressive about it. Just remove it if you don't like cats. You remove it from the place and put it elsewhere. Give it to somebody, or do something to it. You would remove the cancer from that place. When you have finished grading, the other thing which is so crucial is what they call staging. The staging tells you the extent of the disease. How far has this disease gone? This person has got cancer. Is it limited to the breast? So you've got a 1.2 centimeter mass in your breast. It's not gone anywhere. It's just in your breast. What do we do to it? We cut it out. It doesn't matter that it's a tiger kind of cancer. The fact that it is very small, it's still a puppy, you can still take it out. It's a kitten or whatever. You can still take it out because it's small. So you take it out. And that person's survival is the same irrespective of where they find themselves. If it's in Ghana, you'll survive. If it's in the US, you'll survive. 30-year survival rate, very good. You'll be around for 30 years and nothing will happen. The problem is when you have waited and the cancer has reached that point where it has metastasized. At that point, you can't take it out anymore because it's gone into every place in your house, and you should find a better way of dealing with it because it's gone everywhere. It's in your brain, and you just can't take a knife and go and cut your brain. It's in your lung, it's in your liver. It's become what they say is disseminated. That is when you hear people say, "Oh, he's got stage 4 cancer." It means that it's late. But stage 1 cancer, it's not a death sentence. Your outlook is the same as somebody who has cancer in Ghana or who has it in the US because it's small and the treatment is usually local regional. What it means is they will take the local thing out and include, sometimes they don't even include lymph nodes, and include some lymph nodes and you're good to go. But if it becomes disseminated, then the outlook for treatment changes because in that case, they know it is going to be difficult to cure. And so what they will try to do is to manage it in a sense, what they call palliation, making sure you can live comfortably with the cancer. And that is when people panic and a lot of people don't do well. And then you hear all the bad things about cancer. It's also good that you brought up the issue of a changing trend of disease. Yes, Ghana is at that point where we've got what we call non-communicable diseases becoming very prominent in our group of diseases as the infectious diseases go down. This is because we are becoming somewhat affluent and we are taking care of ourselves, and the infectious agents are going down. We are not getting infectious diseases the way we used to get them. But at the same time, whilst we become affluent, we have adopted a living style which is strange to us, which usually would promote cancer. So what it means is that we are becoming more sedentary. We are not exercising. We are eating food that is not our kind of food. We are growing older, and cancers tend to be more common as you age. And we are also becoming a little less careful. But at the same time, we also don't have the same things that other people who are affluent have got. As an example, some cancers are caused by infections with viruses. Cervical cancer is a good example. Human papilloma virus is the cause of cervical cancer. And the solution to that is that you get vaccinated. But as we become more westernized, we are also not getting the vaccine. So it means that more of our people are also going to be affected by cervical cancer. And once they get infected by cervical cancer, they will go on to get once they get infected by human papilloma virus, they'll go on to get the cervical cancer. But if you are vaccinated, you're not going to go on to get the HPV, and therefore you won't get the cervical cancer. And there are many others. Hepatitis B is a good example again for hepatocellular carcinoma. Our diets and rates of hepatitis are rather high in Ghana. Vaccination would curb it. Fortunately, in Ghana, we are getting both vaccines now. This October, we are getting HPV, and we started at birth hepatitis vaccination, hepatitis B vaccination a while ago. So you won't see people having liver cancer as often as we see now. In a few years, that's going to go down.
Yeah. Now, Prof, you've mentioned different types of cancers right now. Liver cancer, cervical cancer. Earlier, you mentioned breast cancer. What can you walk us through some of the various types of cancers and some of the common ones in Ghana, and give us a sense of what causes these and whether they are preventable?
Good. Thank you. So for females, the top two would be breast and cervical cancer in that order. Then if you come to males, the commonest for males is prostate cancer. Now there are other cancers that are not uncommon. So you've got gastric and colon cancer, which has come in very strongly. People are getting colon cancers and gastric cancers. They are getting esophageal cancers. Then we also have liver cancer. We've got blood cancers. These are the leukemias and the lymphomas. Then we've got lung cancer, which is not that common over here because of our low rates of smoking. You've got cancer of the brain, and then you've got soft tissue cancers, and then bone cancers, which are also common in children, where you've got things like osteosarcomas. But then every organ of the body can have cancer in it, because the cells, once they are able to become immortalized, would grow into cancer. So there are so many cancers across the entire body. But then what separates regions from each other would be basic things like race. Some cancers are more common in Africans compared to Caucasians. So if you take prostate cancer, the bulk of prostate cancer occurs in African men. So we have a higher risk of getting prostate cancer. Now, the question is, amongst the Black people who have a higher risk, do some of them even have a higher risk? And the answer is yes. It runs in families. What it means is that there are genes involved. Our genetic makeup can predispose us to cancer. And it's not only to prostate cancer. Breast cancer can be predisposed by genes. Some cancers of the bowel are predisposed by genes. There are many other cancers that you would get when you have some genetic disorders. And these genetic disorders, basically what it means is that you are unable to take out cells that have become rogue cells or are becoming immortalized. The general body with good genes, the right genes, when you see that a cell is becoming abnormal, the body's own mechanism is there to take it out. This mechanism can be corrupted, and there are very straight pathways for doing that. A good example is the fact that you inherit certain genes that don't recognize that this is a bad cell, we need to take it out. So by that, even sometimes a child is born with a genetic disorder that forces or causes them to have cancer at an early stage, like retinoblastoma. It's an eye cancer, and at a very early stage, these children can get these cancers because they are born with a genetic defect. Now, the same thing applies to breast cancer, can apply to ovarian cancer, can also apply to some endometrial cancers and some colon cancers. And in males, it also applies to colon cancers, prostate cancers. Males can also have breast cancer in that scenario. So these things are some of the determinants. You have genes. Then in addition to that, race, as I said, can also be a determinant. Some cancers are more common in some races. Now, if we take breast cancer, we have a lower risk of breast cancer as Black people. However, when we do get the breast cancer, it is aggressive, which means that it is important that we find it early, because if we don't, we always would get to the late stage, and at late stage, we would not do well. Again, if we take race, I mentioned prostate cancer. There are other cancers that are more common in other races. Then, other things that also determine your chances of getting cancer include age. As you age, some cancers become more common, but there are also cancers that are more common in children. You won't find them in adults. As an example, retinoblastoma, Worm's tumor, is a tumor of the kidney which occurs in children. And then you've got things like bone tumor, which occurs in children when they are growing at that stage, when their bones are growing very fast. You can get osteosarcomas and other cancers of the bone in children. Then the other things that are important in the course of cancer, apart from genes and age, include the environment. Our environment packs loads of material that can have a negative effect on us. These include things like diet. You must eat a diet that is rich in vegetables and one that is got a lot of fruits in it. You don't eat a lot of refined products because they take a longer time to be in the bowel, and that predisposes you to having cancers of the bowel. That is one of the things that we are having to deal with now, because our diet is changing. We've stopped eating the bulkier, more roughage-based vegetable and leafy foods that we used to eat. Now people are eating very smooth carbohydrate diets, refined diets. These are mostly European diets, and we never really were eating these diets until recently when we became so-called affluent. So that has an effect. Of course, there are other environmental things like smoking as a choice. And sometimes you are in Ghana, you go to many places and people don't even care that they are not supposed to smoke in public. You are second-hand smoking is so common. Now, smoking is one of those things that is implicated in many cancers. And so if you pick up the habit, definitely you have increased your risk of getting a good example is lung cancer. Then you have occupational hazards, people who work in certain types of occupations and are getting exposed to certain chemicals or certain gases or certain agents like asbestos, factory workers. These have got an increased risk of getting some cancers. Then, of course, infections are also in our environment. And I mentioned some infections. Good examples, too, that I mentioned. I mentioned cervical cancer. I also human papillomavirus for cervical cancer. And I mentioned hepatitis B for liver cancers. There are other kinds. You have Epstein-Barr virus, HIV. It's one of those diseases that winds down your immune system, and every cancer can then come in. And you get strange cancers, including lymphomas and all that. So, in a nutshell, you can see that our environment is a very strong contributor to cancer. And many people do not have genetic disorders that predispose them to cancer, but would get cancer because of the environment and the many agents, including infectious agents and lifestyle changes that are going on in our environment. These have a stronger influence because we are in it all the time. We are being constantly exposed to these environmental agents, and therefore, whether or not you're born with the risk, you can get the cancer. Of course, for those born with the risk, the chances are higher. And so there are other things that they can do to mitigate those. And for those who are not born with the risk, that environment is one of the things you pick up from the environment, whether in your food, whether it's an infectious agent in the air because of your occupation, your own lifestyle. Pick up smoking, you have a sedentary lifestyle, become obesity is a good example of something that predisposes you to cancer. Example of it is being breast cancer. These are things that are important in increasing your risk for having the various cancers.
This is the Super Morning Show. My name is Kojo Yankson. Our guest this morning is Professor Kafui Akakpo. He's an anatomic pathologist, and he's giving us the basics of cancer, and it's part of our Cancer Awareness Month radio series. So far, Prof has defined cancer. He's explained how cancer differs from other diseases, and he's also discussed the development of cancer, the various stages: stage 1, stage 2, stage 3, stage 4. And there are a few things I've picked, and I want to be sure that I'm getting it right, Prof. So you said that cancer could be hereditary. It could also, different types of cancers affect different age groups. Our lifestyles also put us at risk. The environment we find ourselves in also put us at risk. And there are some cancers that are caused by viruses, and there are some cancers that are caused by environmental issues and our lifestyle issues. Am I getting it right so far, Doc?
Yes, please. You got it spot on.
Now,
you got it all right. Yeah.
You've mentioned and given us the different types of cancers, right? I'm wondering, what percentage of cancers are preventable? Are all of them preventable? Or there are some cancers, no matter what we do, we cannot help it but to contract it?
Thank you. So there are those that are easily preventable. I'll use cervical cancer as a good example. For cervical cancer, when you get infected by human papillomavirus, it takes a long while for that virus to integrate itself into your genome and then for the cancer to start. usually we're looking at something in the range of 20 years, unless you are immunosuppressed. So for HIV people, the period is reduced. Or if you have any other reason why you are immunosuppressed, you can have the cancer within a shorter period. What it means is that you can actually track the progress of the changes in the cells leading to cancer. It is a reason why the pap smear was so successful in preventing cervical cancer. Before we even started HPV vaccination in the Western world, women were asked to go for a pap smear every year, and they will look at the cells in your cervix and be able to say that these cells are changing. Let's clean or remove the cells that are around the cervix, and you would not get cancer. And this was very successful. So in that scenario, you know that you can prevent cervical cancer. It's been the most successfully prevented cancer. Now, the next thing the other one I would mention is breast cancer. Breast cancer screening is available in westernized countries. In the Western world, you go and do a mammo, an ultrasound, or an MRI, depending on which one is good for you. And they would be able to see changes within the breast, most of the time just calcifications. And when they see these calcifications, they become more alert that, you know what, this is changing. And they do biopsies thereafter, and these biopsies will be interpreted. And people would be diagnosed at an earlier stage where they have disease that is not cancer yet. Of course, in our setting where we don't have that, what we aim for is the fact that you pick the disease early. And if you did any of the methods that have been suggested, whether it's a ultrasound, MRI, mammogram, or as is routinely said, you should do a self-breast examination or a clinical breast exam. You can pick breast cancer very early, and that, though not preventative, is also life-saving because you pick the disease at stage 1. Prostate cancer, they say you should just do a PSA. You look at your PSA and you find that, oh, the PSA is high. You do a biopsy and they'll be able to tell you that, oh, you know what, your PSA is going high. And again, in prostate disease, you can have disease that is early or disease that has not started. However, this is all based on your risk. You can decide, if you look at your risk, if you have prostate cancer in your family, first degree, your parents died of breast or prostate cancer, it means you have a risk of prostate or breast cancer. And therefore, you would start your screening earlier. So instead of somebody who doesn't know, who starts or who doesn't have a family risk starting at, let's say, 50, you are looking at starting your own, in the case of breast cancer, 20 years earlier. So you would start much, much earlier. Maybe at 30 years, 35, you've already started looking at your screening yourself. Then, of course, there are those other cancers that you'd need things like endoscopy. Colon cancer, you can screen because the cancers go through a process to form. And so when you go and do your colonoscopy, or when they put your scope down your throat, they will look at your throat, your stomach, and then your colon, and they will pick these little growths that are inside your colon. These are early stage changes that suggest that you get cancer, and they will take them out. So some of the cancers definitely can be prevented. And for those that are prevented, people have been very successful. Some countries have been very successful. They've almost eradicated cervical cancer, and they've done so well with breast cancer, colon cancer, and some other cancers because they are screening. Unfortunately, there are those that you cannot screen. You can't screen for them because they don't go through a process that we can track. As the processes go on, they are so deeply seated and they are so concealed that we can't track them. So for those ones, the thing to do is to diagnose them early. So people are now conducting studies to find out if you can put certain cancers like brain cancer, cancers of the blood, you can put them on a screening schedule and follow them up to see if you pick them up. But for those that are caused by viruses, majority of them you can actually screen. You have cancers that are caused by viruses include those of the cervix, those of the anus, some of the throat, and you also have others that have cancer of the liver. If you have hepatitis B, follow up of your hepatitis B with consistent scans of your liver would prevent you from getting there. If you had a nodule, it will be at a stage that is very small and they will pick it out. And so the option of screening actually helps a lot because it does give us the chance to pick many lesions at early stage and prevent people from getting late stage disease.
Now, Prof, talking about screening, can I request for specific screening to be done when I go for my regular health check, my quarterly, half yearly health checks or annual health checks at various hospitals?
Yes, fortunately, that is in your it's your right. You can, when you go to the hospital for your annual screening or half year screening, you can ask that you want to get the screen. In fact, I must say you should not be left alone to ask. A woman who walks into any consulting room should actually be asked, have you ever done a pap smear before? Have you had your breast examined? They should not be let go without basic questions about cervical cancer and breast cancer screening. It's one of the things that we should be doing as a nation because we don't have screening in those established in our system. There are some countries that don't have established screening measures in place, but it is recommended or it is expected of every doctor that when they see a man or when they see a woman, they would ask them, have you had screening done for cervical cancer or breast cancer or prostate cancer? And if the answer is no, they would offer it to them as part of their routine checkup. So that is a right, and you should be able to ask. The other thing that I must add is the colon and stomach. At age 40 or earlier, depending on your risk, you should start having regular colonoscopies and gastric endoscopies to see if you are developing colon cancer, because that's also one of the things that is common in Ghana now. And the recommendation is that you start having your screening around a little above 40, 45 years is good. Earlier, if you have the risk or if you have other things that suggest that you may be developing anything in your bowel, you're having bloody stools, you're having pain in your gastrum, those things. And it's one of those things that you should ask or you should be asked or you should get a recommendation from your doctor that you should look at.
This is the Cancer Awareness Month on Joy 99.7 FM. Our guest for this episode is Professor Patrick Kafui Akapo. We are wrapping up the conversation, episode 1. And for the whole month of October, we bring you conversations on cancer just to ensure that we get the right knowledge to beat cancer. Now, Doc, just right now, you said that when you go to the hospital, you can request for this test to be done, that test to be done. But we also know that cancer cuts across all age groups. So this also applies to children. For example, when parents take their children to hospitals for their annuals and their quarterly health checks, they should also request for some of these things to be done so that they get to establish whether these children are at risk or not, right?
So the good thing about kids is that they don't routinely have these kinds of cancers that we have discussed so far. Of course, I'm sure you've not heard that they've got anything like breast, colon, prostate cancers or cervical cancers. Children don't get these cancers. Like I said, these cancers go through a process of developing. That's actually why you can screen, because when they start small and then they go on and on and on and on, and then they reach that point where they are cancers. For children, they've not been around for long enough. Some of them are barely 5 years, so you don't get these cancers. So it is not a thing that you actually do for kids. However, what you tend to do, which is important in children, is early detection, because unfortunately, kids would not go through that process of prolonged disease before cancer. They would get the cancer, and what you need to do is to pick it up early. A good example is retinoblastoma, where the kids get this whitish change in their eye. When you look at it, it's like the eye, it has this white spot in it. And some people say, like, as if the cat, when you see a cat in the night, if you see it very early, it helps to remove that cancer early. And like all other cancers in children, early detection is the key there. For them, screening will not come in but early detection. And the good thing about childhood cancers is that they are very responsive to treatment. And for many of the cancers that we are talking about for children, you aim for cure. What it means is you actually remove the cancer. You can deal with it, whether it is through surgery or chemotherapy. They are able to completely eradicate the cancer. So finding a childhood cancer early is really, really rewarding.
45 seconds. What should listeners take away from this conversation?
Good. So what I would want to say is that the name cancer should not scare us. Cancer has been with us for a while. However, the key to dealing with it is early detection. And you can do that by going through medical checkups that look for changes within the cells in all the organs that can be screened for cancer.
Great. Prof. Patrick Kafui Akapo, thank you so much for opening the Cancer Awareness Month conversations with all this great information and knowledge. I've put quite a lot on this episode of the Cancer Awareness Month radio series. Now, for all listeners, this month is Cancer Awareness Month on the Super Morning Show on Joy 99.7 FM. Cancer is real. It's but we are increasingly understanding cancer and improving our treatment. And in the next 4 weeks, we'll give you more comprehensive information on prevention, detection, and treatment. Let's work together to keep a very, very healthy Ghanaian population, a healthy global population, and let's work together to kick out cancer. Prof. Kafui Akakpo has been our guest on this first edition of the Cancer Awareness Month conversation. My name is Kojo Yankson. Thank you so much for listening. The Super Morning Show continues. Stay with us.